Hello, my name's Anitra Prince, and today I would like to talk to you about emergency preparedness, planning, and disaster management in the healthcare workplace. As nurses, we hope disasters never happen, but we have to be prepared if they do. Whether it's a tornado, fire, hazardous material spill, or another emergency, preparation before disaster can make the difference between chaos and an organized response that saves lives. Today I'll discuss why emergency preparedness is important, the people involved in the response, the role of the occupational health nurse, and why practicing our emergency plans is essential. Why emergency preparedness? It's so much more than having a written disaster plan sitting on a shelf. It's about protecting the people who depend on us every day. A well prepared organization reduces injuries, improves communication, and allows employees to respond quickly and confidently during an emergency. Healthcare facilities have a responsibility to protect not only the employees, but also the patients, visitors, and surrounding community. Preparation before disaster strikes allows everyone to know their role instead of trying to figure it out during a crisis. Preparing for tornadoes. Because I live and work in Alabama, I choose tornado preparedness for this presentation. Tornadoes can develop quickly and cause widespread destruction in only a matter of minutes. Hospitals must be prepared for structural damage, power outages, communication failures, and a sudden increase in critically injured patients. Preparing ahead of time ensures the emergency operations continue under extremely stressful conditions. I was stationed in the ER during the 2011 Phil Campbell Hackleburg tornado outbreak. We lost 71 lives, and I believe there was like 126 injuries from that tornado. It devastated our community and really shaped the way our facility prepares for emergency disasters. The emergency response team. You have the incident commander who directs the overall emergency response. Hospital administration coordinates staffing and resources. The occupational health nurse focuses on employee safety, education, and emergency planning. Emergency department staff provide triage and patient care, while EMS transports the patients. Fire assists with rescue operations. Law enforcement maintains security. Operations in the hospital keeps the utilities and generators operating safely, and every employee is responsible for following the emergency plan. Emergency planning. Every healthcare organization should have a comprehensive emergency operation plan. This plan includes communication procedures, shelter locations, evacuation routes, emergency supplies, accountability, and the hospital incident command system. The purpose of this plan is to provide a clear process that allows everyone to respond quickly and consistently during an emergency. Putting the plan into action. When disaster occurs, the emergency plan must be activated immediately. Leaders notify the emergency response team while employees work to protect patients and themselves. Triage begins, communication is maintained with EMS and community agency, and every action is documented. Having an organized process reduces confusion and helps provide the safest care possible. Practice makes prepared. Emergency preparedness requires continuous practice. Organizations should conduct tornado drills, fire drills, tabletop exercises, and annual disaster simulations, and after-action review to identify opportunities for improvement. As an emergency room director, I participated in multiple disaster drills and completed several NIMS training courses. Those experiences reinforce the importance of practice before a real emergency occurs. Role of the occupational health nurse. The occupational health nurse is important in leadership role in emergency preparedness. Occupational health nurses educate employees, promote workplace safety, participate in emergency planning, coordinate employee health needs, assist during emergencies, and evaluate the effectiveness of an emergency response plan. They also support employees emotionally after disaster and help organizations improve future preparedness. Recovery begins immediately. The response doesn't end once the immediate danger has passed. Organizations must assess damage, restore utilities, replace supplies, support employees, and evaluate the response, and update the emergency plans based on lessons learned. Recovery is an important part of the emergency preparedness because it strengthens the organization for future events. My experience. This topic is especially meaningful to me because I've experienced a major disaster firsthand. During the 2011 Alabama tornado outbreak, I was working as an ICU nurse. Although I was not scheduled to work in the ICU, I was called in to assist in the ER. That day, I witnessed how quickly a hospital can become overwhelmed. We care for patients with devastating injuries, resources become limited, and staff from different departments work together to provide the best care possible. Later in my career as an emergency department director, I participated in multiple drills and completed NIMS training, which reinforced how valuable preparation truly is. This experience taught me that emergency preparedness is much more than a policy. It's something that truly saves lives. In closing, emergency preparedness begins long before emergency occurs. Every employee has a responsibility to understand the emergency plan, participate in training, and work together as a team. By planning today, practicing regularly, and learning from every event, we can better protect our patients, our coworkers, and our community. I want to thank you for your time, and remember that preparedness starts with each of us. Thank you.